Welcome to the Emergency Management and Preparedness Inclusion of Persons with Disabilities webinar series. I'm Louis Krause from the Pacific ADA Center, your moderator for this series. This series of webinars is brought to you by the Pacific ADA Center on behalf of the ADA National Network. The ADA National Network is made up of 10 regional centers that are federally funded to provide training, technical assistance, and other information as needed on the Americans with Disabilities Act. You can reach your regional ADA center by dialing 1-800-949-4232. Real-time captioning is provided for this webinar. The caption screen can be accessed by choosing the CC icon in the meeting control bar. To get to the meeting control bar, roll your mouse down to the bottom of the screen. To toggle the meeting control bar permanently on, press your Alt key once and press the Alt key a second time. As always in our sessions, only the speakers will have audio. The audio for today's webinar is being broadcast through your computer. Make sure your speakers are turned on, your headphones are plugged in. You can adjust the sound by navigating to the audio settings on the bottom panel. You can adjust the sound by sliding the sound bar left or right in the audio tab. If you do not have sound capabilities on your computer or prefer to listen by phone, you can dial 1-669-900-9128 or 1-646-558-8656 and use the webinar ID of 155-545-130. I do want to remind everybody that the webinar is being recorded and it will be able to be accessed on the ADA Presentations.org website in the archive section of the emergency preparedness region next week. This is the 7th year of this webinar series, which shares issues and promising practices in emergency management, inclusive of people with disabilities and others with access and functional needs. The series covers topics such as on emergency preparedness and disaster response, recovery, and mitigation, as well as accessibility and reasonable accommodation issues under the Rehabilitation Act of 1973, the Americans with Disabilities Act of 1990, the ADA, and other relevant laws. Upcoming sessions are available at adapresentations.org under the Schedule tab in the Emergency Management section. These monthly webinars occur on the second Thursday of the month at 2:30 Eastern, 1:30 Central, 12:30 Mountain, and 11:30 a.m. Pacific Time. By being here, you are on the list to receive notices for future webinars in this series. The notices go out 2 to 3 weeks before the next webinar and open that webinar to registration. You can follow along on the webinar platform with the slides. If you are not using the webinar platform, you can download a copy of today's PowerPoint presentations at adapresentations.org webpage in the Schedule section. At the conclusion of today's presentation, there will be an opportunity for everyone to ask questions. You may submit your questions using the chat area within the webinar platform. The speaker and I will address them at the end of the session, so feel free to submit them as they come to your mind during the session. To submit your questions, you can type them into the chat area text box, or you can press Alt-H and enter text in the chat area. If you are listening by phone and not logged into the webinar, you may ask questions by emailing them to adatech@adapacific.org. That's ADATECH at adapacific.org. Today's ADA National Network Learning Session is titled Research on ADA Coordinators' Involvement in Accessible Emergency Management. ADA coordinators assist state and local governments in making the agency's program and services accessible as required under the Americans with Disabilities Act, the ADA. Emergency management has been identified in case law as a program and service that must be accessible under the ADA. This webinar will examine the results of recent research on ADA coordinators' role, knowledge, and efforts in the programs and services of emergency management in Federal Region 9. We will also cover the overlap with previous research which looked into the knowledge and efforts of local offices of emergency management in the same region. Today's speaker is Robin Gershon. Robin is a clinical professor and researcher at the College of Global Public Health at New York University, NYU. She developed and teaches 3 asynchronous online disaster courses. The most recent is on healthcare disaster management. Dr. Gershon's research focuses on barriers and facilitators to disaster preparedness, especially with respect to vulnerable populations and essential workers, including the healthcare and public health workforce. Her research is designed to inform policy and practice as exemplified by her landmark World Trade Center evacuation study, which helped lead to the first changes in the New York City high-rise fire safety codes in more than 30 years. Along with her colleague Louis Krause of the Pacific ADA Center, she conducted a large national study of disaster preparedness for people with disabilities. They recently completed a study to determine the degree to which the needs of people with disabilities are addressed in local emergency management in FEMA Region 9, disaster planning and response activities. And this research on ADA coordinators builds upon that body of work with the goal of reducing disaster-related morbidity and mortality disparities in people with disabilities. I will now turn it over to you, Robin.
Okay, thank you so much, Louis, and thank you to all of you out there taking time out of your day to come and listen to us. We're delighted that you're here. I'm delighted to be here. Believe me, in more ways than one, I am very delighted to be here because I am in Manhattan right now. So I'm going to go to the next slide. And I may need Gabriel to help me with that, Louis. Okay, I see you have it up. And on the next slide, you can see we are acknowledging not only Louis, of course, our product statistician, Cheesy, and Patty Medina, our research assistant, and very grateful for funding from NIDLR to help us support this research. On the next slide, we also very much are grateful to our expert consultants who helped us enormously. These are people with deep knowledge of this field, practical field, including Allie Everett from Pasadena, Lanny Davidson from Marin County, and Kristen Darmody from the Department of Health in Oregon. Thank you to all of them. On the next slide. So today what we're going to do is talk a little bit about the roles and responsibilities of ADA coordinators in disaster preparedness and response. We'll review why it's important to know if the ADAC, which is how I'll refer to them, are prepared to meet their responsibilities under ADA. We'll talk about our survey, and then hopefully in our discussion, we'll talk about how we might apply these findings. On the next slide. Our learning objectives today are quite straightforward. We're going to determine the roles and responsibilities of these coordinators. We'll identify some of their barriers to their ability to influence other entities that are charged with ensuring ADA access with respect to emergency management. And we'll discuss at the end some strategies for improvement. On the next slide, these are the responsibilities in general under Title II of the ADA that all state and local governments must comply with. Therefore, under Title II of the ADA, all emergency programs, services, activities, and facilities must be accessible to people with disabilities. And this applies not only to them, but it applies to any third parties that are involved, such as the American Red Cross or private nonprofit organizations and religious entities. On the next slide. So under Title II of the ADA, state and local governments with 50 or more employees must appoint an ADA coordinator. This coordinator implements and coordinates all ADA compliance activities in that local jurisdiction. And as you can imagine, and many of you probably are ADA coordinators, this is a huge undertaking. They also conduct self-evaluations and they develop plans. They monitor the implementation of those plans, and they also handle requests for aids and services. So they have a very large role, very broad role and set of responsibilities. On the next slide, they also provide information about accessible programs and services in their jurisdiction. They serve as an ADA resource, and they receive and work to resolve complaints from the community members. They work with a wide variety of officials and administrators to ensure new facilities or alterations are all accessible. On the next slide. So the OEM, just to reiterate, and by the way, we do have a paper that is now under submission, and as soon as that paper is accepted, I know that Lewis will be very kind and put that up on their website, and we'll have that available to you. Our findings from that study were quite interesting. It was, to our knowledge, the first study of its kind, and we did find some very severe, I would say, and some suboptimal preparedness for people with disabilities at the OEM level. But in any case, the OEM is the agency at the local or state level that is responsible for all planning, responding, and recovering from disaster events. They can vary in size from very small, just a single person or two, to well over 200 professionals with all diverse backgrounds and areas of expertise, including the individuals that may be assigned from other city agencies. Next slide, please. These emergency managers are responsible for managing the resources before, during, and after a major disaster or emergency event. They conduct activities related to key components of emergency management, such as drills and education, exercises, and they coordinate with all the various partners in the emergency management process. On the next slide, you can see here, and this comes right to us from the National Response Framework and Plan. And by the way, on a lot of these slides, we have some extensive notes and hyperlinks and various documents that may not be that easy to access normally. So we've tried to make them easily available to you. But here is the bottom line, and this is absolutely the case in the disaster we're undergoing right now with COVID. This is the case for every single type of large-scale disaster. Everything starts local. Everything moves up the chain of command. For instance, at the Department of Health level, they go to their State Department of Health. When that is not enough, they go to federal resources, which is HHS and CDC, and so forth. So everything goes up the chain. We start local, we use the resources at hand, we try and resolve the problem locally. When we cannot, we look to the state. If the state cannot, we look to the federal government. On the next slide. And here is where all of this is spelled out. This is the most recent edition from October 28th, 2019. It's a lengthy document. It's a kind of dry reading document, but I urge you, if you have not taken a look at this document, this is the National Plan for Responding for Disasters. And it works quite well when we're dealing with all kinds of climatological or environmental type disasters. We are seeing some of the gaps right now in terms of a biological disaster or pandemic event. On the next slide, and to that end, very recently, about less than, I guess it's 3 weeks ago, this document came out, which is our government response plan. These plans are very difficult to write and prepare. Typically, they take years of development, so there must have been, I know there was, a national pandemic plan already, some kind of boilerplate. And so it was quickly revamped to become the COVID-19 response plan. I must confess, I haven't read the whole thing yet, but I certainly will. And I urge you, all of you, to take a quick look through or scan through this document. And we have a link here. On the next slide. So in emergency management, people with disabilities are considered to have access and functional needs. And there are a whole host of different inclusion criteria. And these include people with physical, developmental, or intellectual disabilities. Lewis and I have been going back and forth earlier today, about some very disturbing news reports of developmentally disabled people in group homes and how they've been incredibly hard hit by COVID, to the point, at least in several places in the greater metropolitan area, where their caseworkers, their aides are sick themselves, and there have been several deaths, but the ones that are not sick are afraid to come in. So it's becoming a very critical situation, at least here, and I think also on the West Coast. So it includes people with all kinds of visual impairments, mental health conditions, physical disabilities, cognitive, any kind of chronic condition or injury, people with limited English proficiency, older adults, children, and people who are low income, homeless, or transportation disadvantaged. It also includes pregnant women. Next slide, please. So why is it important for us to know how well the ADA coordinators are doing in terms of meeting the needs of people with disabilities with respect to emergency management? On the next slide, the main thing for us, for all of us, is that the true and absolute fact, absolute clear fact, is the fact that we have major and converging trends that are increasing the risk of disasters, not only in our country, but throughout the world. On the next slide, we are one, unfortunately, of 5 countries, the top 5 countries with the greatest frequency and severity of disaster events. This includes China, India, the Philippines, and Indonesia. But we are usually number 2 on this list, right behind China. And that's because of our geography. It's where we are in the world. It's our coastal areas that are built up. There are quite a few reasons for it. It's also large population base. On the next slide, these are some of the increasing concerns that we have for these, especially climatological. Most of these large-scale disasters are driven by meteorological or climatological changes and threats, including bio-event disasters. And these risk factors are listed here for you, and these are very well documented. There is no question that these are the risk factors that are increasing these disaster events. Number 1, of course, is human population growth, followed by climate change, globalization, urbanization, and coastal development, land use that and population practices that facilitate zoonotic transmission, which increases also the risk of vector-borne diseases and animal-to-man transmission, as we're seeing here. And of course, substandard public health and healthcare systems, even in the US. We had a very robust public health system We still do for the most part. And for many years, it was a kind of a known fact that the US served as the disaster responder for the rest of the world. Here we have some kind of event that impacts the entire world. So it's very hard for us to now help other countries. We also have increasing threats because of declining vaccination rates and overuse of antibiotics. And lastly, we have on this list, excuse me, mass migration and displacement of refugees, many of them staying in these squalid refugee camps. And of course, that increases the risk of disaster. If a disaster happens in that area, say a hurricane, but also for any kind of biological disaster. On the next slide. Just take a sip of water. Especially now, readily and rapidly spread novel pathogens are our threat. On the next slide. And the next slide, thank you. You can see here just a small sampling from the last 2 or 3 decades. We have had over 80 different brand new novel pathogens, novel or reemerging, such as measles, you could say, would be in this category. The most recent, of course, is COVID-19. So since I began my studies in public health disasters, I worked on SARS in the early days. Then I did some research around, and of course, HIV, early days, HIV, MDR-TB, but then SARS, Ebola. I did some studies on H1N1 and also the anthrax attacks in New York. And now we are ramping up for studies on COVID. Most recently, we'll be doing some research around the transit workers and their risk and risk factors and the occupational safety controls that were put in place for them or not. Next slide, please. So the other reason that we are concerned about whether or not ADA coordinators are ready and are able to fill their roles is because we have a very large percentage of people in the US with disabilities. This number is growing. The last numbers I saw from the CDC, I think it's on the next slide, please. Yes, the last number I saw is about 25%. These numbers vary depending on who's collecting the data. Lewis, of course, prepares the annual report, and typically his numbers are, I think, probably the most accurate in the country. But you can see here it's a very large proportion of people in the country. And unfortunately, on the next slide, as you can see, this population is going to be growing. It is growing already, and that's because of the US aging population. So I'm showing a slide here that's a graphic that's showing that the age distribution of people with disabilities increases dramatically with age. And as we get to people over 65, this slide is showing that 35% of our population of people 65 and over in the United States have one or more disabilities. So this is a growing concern for the disability community, as well as for public health and pretty much every other sector in the US. On the next slide, please. We also found in that very earlier study that Lewis alluded to, there was a 2011 study, so now it's going back almost 10 years. We found in that study that people with disabilities were generally not well prepared for disasters. We had a 7-item preparedness measure. That score was only 2.3 out of a range of 0 to 7. So if you can do the math quickly, it was about 30%, I think, that would have, if it was a test, that would have been their score. Only 32% had emergency supplies available at home. Only 29% said that they could communicate with their personal assistant or aide in an emergency event. And only 26% had backup plans for their PA, and that was only the sample that actually had a PA. On the next slide, please. Only 47% had even a rudimentary emergency plan. and only 2/3 of them had included their PA when they had made that plan. 4% involved some of their PAs, and 10% involved none of their PAs. And these are some of the reasons that on the open-ended part of the questionnaire they gave. For instance, my PA will be busy to the needs of their own family. My PA is just not that dependable, or I might not be with my PA when there's an emergency. To the extent during our current disaster, I do not have any data yet on how well it's working, that the PAs can be with their caregiver, but they would be considered an essential service, and they would be allowed to be out and about and using the subways. But to the extent that that's happening, I simply don't know at this point. On the next slide, please. More recently, we conducted a study on elderly home care recipients now in San Francisco with a sample size of 50. They also had a very low score with only 4.74 mean on a 13-item scale preparedness checklist. Only 56, so these are elderly, fairly disabled, I would say. All of them had home care. Some of them just a few hours a week, but most of them at least a couple of times a week, and maybe for a full day each of those days. So they were, for the most part in our sample, they were all living alone, and they depended on their caregiver, their home caregiver. Only 56%, and this is in 2014, had extra medications on hand. 44% had backup power for the powered equipment that they actually depended upon. Only 38% here had made plans for their caregiver, backup plans, and only 26% had plans for transportation to shelters or had any idea of how they would get there. And only 19% had someone who lived in their building that could help them evacuate if the elevators were not working. But remarkably, 70% that had a pet had extra supplies on hand for their pets. On the next slide, please. And these were some of the barriers that we identified. These were in-person interviews conducted in their homes. And so they were qualitative in nature. Partly there was a survey attached, but we could talk to them about what was some of the reasons. And some of the reasons that they felt they could not prepare was a lack of self-efficacy. The government should help me. Risk awareness was high. They certainly knew they were at risk for earthquakes, but many of them were fatalistic. They felt that they lived a long life and they were ready to go. Their sense of community was surprisingly low. There's an interesting thing happening both in San Francisco and certainly in New York City, I'm sure many other cities, where there is a generational divide. There are still quite a few elderly people living in all kinds of buildings, walk-ups, high-rise, low-income housing. There are also younger millennials moving in, and they are not mixing yet. Now, during this particular disaster, we're hearing of really a much better outreach to people who live near some of these millennials who can't go out, and they're offering to get groceries or check in on them every day. So that's kind of a new development, which is very, very positive. And also these people in the sample, they had a large lack of trust in the authorities and did not feel that you could depend on anyone in the city or the country, at least. Next slide, please. We also have data that tells us about people with disabilities that is it's disconcerting, I would say, is the report here. This was a general population-based, very robust kind of sampling, very well done. 21% of the sample in this survey said they were not planning to do any disaster planning whatsoever. 46% said preparedness was not on their radar at all. And cost and not knowing what to do, how to do it, were their major barriers. However, people who thought they were at risk, thought they could do something to prepare, and thought that preparing would help them, were more likely to be prepared. And the interesting thing about the FEMA study is that only small differences in preparedness were noted for participants with a disability, which mirrors what Lewis and I have found in our earlier studies. On the next slide, please. To recap then, why is it important to know if ADA coordinators are ready to help ensure and meet the needs of people with disabilities? It's because disasters are increasing in frequency and severity. The vulnerable population is large and growing, and individual level preparedness is low. And finally, on the next slide, please. This is absolutely the case, that people with disabilities, and we are absolutely seeing this right now playing out in real time, people with disabilities are disproportionately affected by disaster events. Some data suggest as high as 30 to 50% increased risk of morbidity associated with a disaster event. And COVID-19 is clearly exposing some additional potential vulnerabilities, including access to limited resources. And we have, I believe on this slide, some links to some information regarding that. On the next slide, please. So we conducted this study last winter. Went into January. We had this wonderful key stakeholder input, including also some input from June Kills and Marcy Roth, some other folks that are very prominent in this field who are gracious in sharing their expertise and knowledge with us. This was a confidential web-based survey. It was a multimodal recruitment. It was a convenience sample. And we included about 36 items that took about 15 to 20 minutes to complete. When we were done, we had results, cleaned results that we could use, because actually we had a much larger sample, close to 200 people, but many of them we took them out of the sample because after the first question about, are you employed as an ADA coordinator, and they said no, they came right out of the sample. So our final sample was 131 people from FEMA Region 9. And you could see here, FEMA Region 9 includes California, Nevada, Arizona, Hawaii, and the Pacific Islands. On the next slide, please. So most of our respondents came from California, followed by Arizona. About a quarter had an estimated jurisdiction size of about 1 million residents. 20% had 100 to 500 and so forth. And then about 40% of the respondents had at least one major disaster event in their jurisdiction in the last 5 years. Only 18% of the sample knew the approximate number of people with disabilities in their jurisdiction. On the next slide, please. The demographics of the sample are as follows. More than half were female at 56%, 35% had a disability, more than half were 50 years and older. Very educated group with 86% having a college degree or higher, yet 30% earn less than $50,000 a year, with only 20% earning $90,000 or more per year. On the next slide, please. Their employment information is as follows. 44% were working full-time as an ADA coordinator. More than half worked as an ADA coordinator for less than 3 years, and 20% worked in that role for less than 1 year. Most of them were based out of either the ADA coordinator's office or Public Works, and the majority reported to the city manager or their assistant or the director of planning, and a few reported directly to emergency management. On the next slide, please. Only 32% had held any kind of ADA-related job prior to their ADA coordinator job, and 28% had previously held some type of emergency planning job. A majority, 69%, held jobs and with other job titles. So they had more than one title. In other words, they were the ADA coordinator and something else in their jurisdiction. More than half of them, 56%, worked alone in the role that they played as ADA coordinator, and less than half, only 43%, had backup to their emergency management duties if they are not on duty. Think about that right now in America. 70% said that they spent less than 10% of their job on ensuring ADA compliance in emergency management. That's worth repeating. 70% spent less than 10% of their job time on ensuring ADA compliance. Next slide, please. This is an interesting set of questions, and I believe this came from one of our consultants that told us to put this on, and I'm really glad they did, because we asked them what qualifications or special training are needed for this job in your estimation, and 26% said none. 19% said you need to complete an ADA basics course. 11% said you need to complete the 40-hour training credits for certification program. And 7% said, I don't know. Next slide, please. And we asked them a lot of questions about what are their job duties involved? What are they actually responsible for? 56% said they are currently responsible for ensuring ADA access with respect to emergency management. 39% said they do it by providing technical assistance. 34% do it themselves directly. 28% say they make sure it is simply in the plan. 24% provide technical assistance. 24% said they serve on the EOC. And 13% said, I do not ensure ADA access with respect to emergency management. Next slide, please. We asked them, well, who is responsible for assuring access with respect to emergency management? And 56%, as we saw before, said, I am responsible. But we often do this in our surveys. We often embed a similar question that we think is important in another area of the questionnaire to kind of get like an internal, validity check on it. And so we did that again. And in the latter part, when we asked that question, this time they said 45% said it was OEM. 11% said first responders are responsible for assuring access. First responders, right? 9% said it's ADA coordinator, and 8% said no one is responsible. So here again, in the second part, 9% said ADA coordinator, whereas earlier 56% said I am responsible. In between this asking of this twice, we had a whole host of questions of what the job would really entail. And so perhaps that helped them understand what was really involved, and that's when their thinking about it changed. On the next slide, please. So this was a very important set of questions, really important. The capabilities. What are their own sense of capabilities? 22% said they felt knowledgeable with respect to ADA requirements for emergency management. 16% said they felt influential in terms of influencing other entities. And 36% felt that they have had adequate training in this area. We did some correlations with these items, and as you would expect, of course, these were highly correlated. People who felt knowledgeable felt they were more influential and that they had had adequate training. On the next slide, please. So what are they specifically responsible for? We have these quite a list of quick items. They could just say yes or no, or I don't know, or somebody else. So in terms of reading the emergency operations plan to ensure ADA compliance, 27% of the ADAC said that they are specifically responsible for that. But 26% said they are not sure who is responsible. When it comes to writing and updating the emergency operations plan, only 12% of the ADA coordinators said they are responsible. Again, a large number, I think it's large, 12% said they're not sure who actually writes and updates the plan in their jurisdiction. Providing oversight to ensure ADA compliance. 16% of the ADA coordinators said it was them. A whole bunch, 15% said they're not sure. And then this is so critical, involving people with disabilities to help identify their needs. ADA coordinators, they said 23% said they are the one that helps to involve people with disabilities, and 18% said they're not sure. On the next slide, when we get to ensuring all communications are accessible, and I have seen over the past 3 weeks communications on national and local TV, and I can tell you, I think local TV definitely does better for American Sign Language, because I definitely noticed that our Governor Cuomo and our Mayor de Blasio, they always have, and you can see them, they always have American Sign Language, but I don't always see it on other places. So ensuring accessible communications, 11% of the ADA coordinators said it was them that's responsible, and 11% said they're not sure who is responsible. This was important. Ensuring accessible transportation, only 9% of the coordinators said that that is their responsibility, and 14% said they are not sure. Another important one, who is ensuring that shelters are accessible? Only 13% of ADA coordinators said it's their responsibility, and 16% said they don't know who's responsible. And involving people with disabilities in all drills and exercises, 15% of the ADA coordinators said they are responsible, and 18% say they are not sure. Next slide, please. Specific to shelter operations, which are so critical, especially if you're in a place where there are these climatological or meteorological disaster events like hurricanes. On the next slide, please. So ensuring, so now we're at the shelters. So ensuring refrigerators for medications are available. 6% of the coordinators said they are responsible. 20% said they do not know who is. Ensuring access to personal assistance to the shelters. 5% of the ADA coordinators said they are responsible. 15% said they don't know who is. Ensuring that there's oxygen at the shelters. 4% of coordinators said they are responsible. 16% said they don't know who is. Ensuring there's backup power for powered equipment at the shelters. 5% of the coordinators said they are responsible. 13% said they do not know who is. Providing access to service animals at the shelters. 9% of the coordinators said they are responsible. 15% said they're not sure who is. And finally, accessible communications at shelters. The ADA coordinators said they were responsible in 9% of the cases, and 12% were not sure. On the next slide, so ensuring the accessible transportations and ensuring shelters are accessible and including disabilities, this is up here again because these are critical elements. Somebody has to be in charge of these elements. A lot of times, of course, it's the OEM, but in terms of making sure all of this is accessible, there was a very low percentage of the ADA coordinators' engagement. Next slide, please. This was interesting, ensuring that the people with disabilities are not sent to medical shelters unless indicated. 18% of the ADA coordinators said that they are responsible to ensure that they are not sent to medical shelters. 16% said they're not sure who is. And ensuring that people with disabilities are not turned away from shelters if their personal assistant is not with them. 8% of the coordinators said they're responsible to ensure they're not turned away, and 15% said they're not sure who is in charge of that. Next slide, please. This is interesting about the recovery. So providing input to after action reports, which can be critical, especially if they then really are implemented and written into plans and turned in, operationalized, turned into ConOps. But in 28% of the coordinators said that they did provide input to after action reports, but 13% said they're not sure who does. The ADA coordinators said they are responsible for involving people with disabilities in preparing those after action reports. 24% said that, but a whole bunch, 15% said they are not sure who helps involve the people with disabilities in those reports, and helping to change policies based on the results of the after action reports. How critical is that? 31% of the coordinators said they are responsible, and 14% said they are not sure who is responsible. On the next slide. So we're wrapping up here. We'll just end up with these few slides. So these were open-ended questions, and I put in caps when I saw it in their open-ended as caps, because I know it was important to them. So we asked them, what limits your effectiveness? So all in caps, somebody said lack of time with an exclamation mark. Lack of awareness was next. Lack of resources, lack of staff and competent staff, lack of knowledge and training, lack of authority in my role as an ADA coordinator. And this was interesting. Changes in administration makes it hard for me to develop relationships, and several people had that same trend of thought. On the next slide, when we asked them what would increase your effectiveness, again, more training, all in caps, exclamation, exclamation, more support from other entities, including OEM, more involvement with OEM, and more collaboration with Red Cross. Just OEM came up over and over again. They would like more coordination with disability organizations and stronger work relationships with other entities, and a more supportive work environment in the offices that they are in. On the next slide, please. So we asked them, as you know, what specialized training. We had this slide, these data up earlier. And if you recall, the large, I think, a large proportion, 26% said there is no specialized training needed for my job as an ADA coordinator. Clearly, that's really not the case. But when we did the OEM survey, interestingly, 17% of the OEM directors said that there was no specialized training for that type of job. On the next slide, please. So in conclusion, and these are still preliminary data, we'll definitely do some more analyses before this paper goes out and before it's posted by Lewis, but I think we can see that there is clearly some underutilization of the specialized skills that many, if not most, ADA coordinators can bring to emergency management. Clearly, there was an interest in improvement and increasing that role and playing a larger role and having a more effective role. And there can be no question that disability expertise and knowledge of ADA is absolutely essential at all levels of disaster response. On the next slide, I put our preliminary recommendations. These are still being developed, but we would love to get your input. We clearly think that it's a job, but it's really a profession. And I think Lewis would agree. I don't know, we haven't talked about it that much, but I think it's important that we professionalize this role. These are professionals in emergency management and of course in ADA. I think their role needs to be clarified as part of the whole team. And I think they need standardized tools and resources. And of course, just-in-time tools that they can apply right now to any disaster event. And on the next slide, I believe that may be the end. Yes, it is. And I thank you. And the last few slides are some wonderful resources that Lewis has kindly put together for us. And I believe if you go to the next slide, you can see the link here. And so you can get to this center and other webinars on there, and they have some fabulous webinars on there. And the next slide, I think, has checklists and tools, some great tools that go out wide to all kinds of folks all out and maybe not even in this country. And on the next slide, I think he's put a resource on the next slide for information that has to do with COVID that's up now on their website. So I think we will, and here it is. So I think we will end here and start taking questions. Okay, Lewis?
All right, thank you very much, Robin. All right, everyone, please remember to submit your questions in the chat window and we'll get to those in a moment. I wanted to, if I can step out of my role as the moderator for a moment and into my role and as part of this, I do want to emphasize that in the data that you saw that Robin reviewed, I think it gets hard to do this when you present like she had to do there, but the word only is really important when you saw all of those numbers. So it's only 20% or only 15% or only, these numbers were extraordinarily low and demonstrated that the ADA coordinators were really not that involved in emergency management, which is particularly problematic because in the previous research on emergency managers, their numbers were also very low, which meant that the emergency management office wasn't paying attention, didn't feel it was their responsibility, and they weren't using the ADA coordinators to help them. So how is it getting done? And I think we know how that might be answered. All right, let's move on here to the chat. And actually, while we're doing this, Gabe, can you put back up Robin's email address so people can get that if they wanted to ask her questions? The first question here was about, can we address why effective communication is not happening for people that use ASL and even those using captions? The captions are not done well at all. What can we do to address this minus changing laws in the future in response to the issues? I don't know, Robin, if you want to take that or I can take that.
That is the million-dollar question. Why is it not happening when it is the law? So I'll let Lewis take it from there.
Yeah, I think you know, in terms of this research, I think what you saw was how much people were not necessarily, you saw that responsibility section, who was responsible for that, and the ADA coordinators didn't think it was their responsibility. Now that's a huge gap because the emergency managers aren't involved in that. So it could be that this is an interpretation and maybe it's a chief public information officer who does have the responsibility in the parlance of an organization. But I think that ADA coordinators ought to really consider that that is a key element of what they ought to be making sure gets done. So, all right, next question. This is a technical ADA question, and I'll briefly answer it, but I do want to encourage everybody to reach out to the ADA centers with your ADA-related questions that may have come up in listening to this presentation. This question had to do with if an organization has less than 50 employees, who assigns as an ADA coordinator, and is there a different title than ADA coordinator for less than 50 employees? So I'm going to actually even use this as a demonstration for all of you. I think this is an ADA question, and there are 10 regional centers across the country who have a responsibility or have the ability to answer your ADA questions. Together, we're known as the ADA National Network, and you can reach any of us with free confidential information at 1-800-949-4549. 4232. So if there was a question that popped up to you about this around the ADA, I would encourage you to call the centers and ask those questions, and they'll be able to tell you what the ADA says about these items. All right, the next question. This is, Robin, this is when you were referring to the government plans, the response plans, and one person wanted to know if there's a clickable link to the government plan.
I couldn't figure out how to put the hyperlink, so I put the web address. So I think if you just copy it and put it in your browser, you can easily go to it. But maybe at some point, maybe before you put up these slides, you can have one of your folks make a hyperlink to it.
So the slides are available. What Robin's referring to is that the slides, these slides are available at adapresentations.org in the schedule section. Today, as of tomorrow, it'll move over to the archive. And the slides are there, and in the notes section for each of the slides, you will find the links that she's referring to, and that will be the answer.
Even on the front of those national response plans, it's right on the front of those slides. So you just copy it and put it in, you know, your Chrome or Firefox and go to it, because they're really, I mean, to me, they're fascinating readings, but they could be kind of dry, but I think they're really useful to look at.
Okay. The next question had to do with, excuse me, I think in the listing of access and functional needs, I believe is what this person's referring to. Is the penal system included in the listing for risk factors?
Yes, I have seen it. I have seen homeless and prisons. They are considered a vulnerable group, and that slide should be fixed because they are considered. And of course, we are seeing that right now.
Yeah.
Right now.
Okay. Gabe, can you move back to slide 44 and 45, where somebody had a technical question about what's the difference between the two data points on providing technical assistance on 44, okay, and 45.
This is a generic question on this 45, which was also on 44, and that is, who is responsible? That was the question. Who in your jurisdiction is responsible for ensuring access with respect to emergency management? And earlier on in the survey, 56% said I am. The ADAC said I am. But later on in the survey, when we buried it in some other items, it dropped all the way down to 9%. And that came after all those questions that I rolled through on, do you do this, do you do that? So, I mean, we'll never know what exactly was in their mind, but I have a feeling when they actually started to see, oh my goodness, this is what is really involved in ensuring access, then they thought, oh, wait a second, I guess I'm really not. You know, they were being maybe honest, and maybe they were being honest at first, but they didn't simply know what it entailed.
Okay. There was a comment in the chat from someone who at Niagara University who has done a disability awareness training program for first responders and emergency management, and wanted to just let people know that there are many disability awareness programs that are out there that you can find through your ADA centers. The point here, I think that was made in this research, is that these ADA coordinators, these jurisdictions, may not have been taking advantage of knowledge that is in the field and out there for people to become more aware and able to get their ADA coordinator, their emergency management offices, the information that they might need. Next question. I serve as an ADA coordinator for a correctional facility in Georgia. What are the primary responsibilities for facility ADA coordinators? Okay, that one I'm going to ask that you call your ADA center. I don't want to take the time from this session to go over all that detail, but you do have the general facility issues of physical access. Equal opportunity is the fundamental way to think about the ADA. And you also have effective communication in your reasonable modification of policies and procedures. And you can talk to your ADA center, your regional ADA center, more to get more detail about that at 1-800-949-4232. Well, Robin, somebody wrote and said that Governor Cuomo has not had an ASL interpreter at his side the entire pandemic, and there was a DOJ complaint that was filed by Disability Rights New York.
Really?
So there you go.
He has all the times. Well, I've started watching him, I would say closely. You know, he comes on at 11:30, and that's, you know, like right in the middle of the day, but so pretty regularly I'm watching him. And all the times that I've seen him, he has had. Now I noticed they have like a little, they're not next to him anymore. I think they may be in a separate room completely. So it's like a little box that I'm seeing now up on the screen. So in the beginning, they were right next to him or right behind him. Now they're in a little box, but that's disturbing.
I will also let people know that if you are involved or concerned about press conference accessibility, we do have a fact sheet on that, a checklist on that at adapacific.org, and Gabe, maybe you can scroll down to that. That is a checklist for you to use for making press conferences accessible.
I'm going to send it to his
down.
office. I'm going to take that checklist.
Right there at the bottom, yes. Press conference checklist. Okay.
Yeah, I'm going to take that, Louis, and send it to both Cuomo and de Blasio, but de Blasio really has also had that. Also, now in a little tiny, in a smaller box. But I can't believe they don't have access to that kind of checklist, but I'm going to send it. I'm going to send it today, yeah.
Next question or point. And thinking more about this, to increase effectiveness, we need a seat at the table, and we being ADA coordinators. Can the people who create the best practice EOC models, or Emergency Operations Center models, that include logistics, planning, etc., add in an AFN coordinator, access and functional needs coordinator role, or something similar? This is a great point, and in fact, we have just signed up another webinar for, I believe it is June, where someone who has done that has gotten themselves a seat on the Emergency Operations Center. Will go over how that was achieved and done, and so all of you can look forward to coming back for that to find out how you can get on the EOC or how someone else got on the EOC. Here's someone who actually answered the role. I answered the survey that I have a role in the EOC. I'm learning in the current scenario that I might not. Only portions of the EOC have been activated and I have not. I'm also now not sure my role is even identified in the EOC structure. So there's an ADA coordinator who's not even sure how they're actually in the EOC, if they are.
They should be. They should be, and they should absolutely be right now. That is not right. And what I would do is I would call the director's office, OEM office, and say, I notice I'm not activated. I'm not at the table. And I need to be. I need to be. I mean, that just makes no sense whatsoever.
Pardon me. So next question. What would be your suggestions as to not only education and awareness of the importance of emergency preparedness as a whole, but specifically targeted to the disability population? There are a variety of issues or efforts, I should say, going on about emergency preparedness specifically for people with disabilities. And the disability community has been working very hard at sort of getting that information out into the communities. I know in California we have a very large effort that's been going on through the state, through what's called Listos California, where the efforts are really aiming at getting people with disabilities, seniors, others with access to functional needs up to speed about their own personal emergency preparedness. So you may want to look that up, Listos California. Next question. As part of your solutions, are you proposing an elaboration of the professional role for ADA coordinators in emergency management specifically, or an elaboration and further professionalization of the ADA coordinator role more generally?
Well, I'll take a stab at it first, Louis. We can see that these people are highly educated, right? They're coming from all kinds of backgrounds, I would imagine. I think it would not be remiss to think that at some point they need to have some kind of certification. I know there is an active group towards that. I think they need, I don't know if I want to say license, but some kind of a professional certification. I'm not saying, you know, go back to school and now get a master's in ADA coordinator, you know, position. Although one day that may come. We are already seeing it happen with emergency managers more and more. So it will probably come, is my guess. I don't know yet any place that's really doing it outside of the ADA coordinator organizations. But I think these people can do a lot more, and I think they're not being utilized to their full capacity. And maybe credentialing is the way in.
And I would just add that if, in the context of this subject, that whatever efforts the ADA coordinators are undergoing to learn more, they certainly need to understand how they can improve their role in emergency management services and programs being done by their jurisdiction. The next question. Each agency has over 50 has an ADA coordinator. I think that means employees. Has an ADA coordinator as an additional function of their job. Is that acceptable? I am not sure I understand your question completely, but let me say that it sounds like you're saying that, and I think Robin referred to it, that the ADA coordinator sometimes is given that role in addition to other tasks on their job. And I think we discovered in this research that that is somewhat of a hindrance to some people being able to do a complete job. So there is something that needs to be looked at there by jurisdictions.
It has to be valued. They have to be paid appropriately for their expertise. They have to have the seat at the table, and they cannot have multiple different jobs and also not have any backup, because a lot of people are out sick right now, and that's a critical role, the ADA coordinator. And if there happen to be one of the people out sick, that is not good. I definitely think you need to have, you know, cross training and backup, but this is such a big job. I've been going to the ADA conferences that the Pacific ADA and other centers are sponsoring. I'm really learning so much about, from so many angles, including all the issues in healthcare facilities and issues in schools and transportation, bus stops, bathrooms, everything. And that's a huge portfolio for a single person to have. And on top of it, to really be on top of shelters and transportation, accessible transit, it seems like a lot for one single person. So having any additional jobs sounds really, I don't know how you could do it.
Okay, the next question. Robin, you mentioned having this role as a profession. When I was an ADA coordinator, when I was the ADA coordinator working with emergency management agencies, it was very difficult to gain any credibility as a subject matter expert. What suggestions do you have to include ADA coordinators as an equal member of the emergency management team?
That just makes no sense whatsoever. If anyone's the expert, it's them. So that's why I kind of alluded to licensing, certification, having these this kind of imprimatur that you are the expert. You are the expert. Why aren't they respecting that? Well, I think it's going to change because the whole OEM area is changing and professionalizing with college degrees in emergency management, master's degrees, and now even a few doctoral programs. These people they know that national response framework inside and out. They know their local jurisdiction codes and their plans. And as that professionalizes, they can only help but understand that your role is critical and must be influential. So, it may take time, but perhaps when you're doing trainings or running drills or stuff like that, writing the memos, they can see what you can bring. And it would be foolhardy not to listen to this advice. So I hear you, and I empathize with you.
And I would just say, and we don't like to go here, but since the case in Los Angeles effectively said that emergency management services and programs need to be accessible to people with disabilities, there is an ADA precedent now. And so jurisdictions need to be aware of that. And if the ADA coordinator is one of the key elements of a jurisdiction, getting the ADA information to their programs and services, this needs to be brought to bear in all the jurisdictions programs, including emergency management. Next question. VRI, video remote interpreting, was not set up at COVID-19 screening sites. Why all fights until finally federal and state agencies intervened and made it mandated? Why fights? We're going to have to. This is a philosophical issue and one in which you're raising that has to do with how people do anything related to the ADA until there is pushback from the community, and I think sometimes we've learned that sometimes it's people not being aware of anything, of being aware of the ADA or of the needs of people with disabilities. Sometimes it's it's mostly about that, and so that's why ADA centers are around. That's why others are around, trying to make sure that everyone is aware of the requirements and the basic understanding and tenets of the ADA, so that people don't have to fight all the time to get their rights understood and dealt with. Next question. For COVID-19, the CDC suggests that local health departments provide alternate care sites for homeless populations. Are you seeing that happen? Where would funding and staffing come from for that service?
I'm definitely seeing it here in New York City. They've been putting up homeless in some of the hotels that are empty. And they're doing it in several other states, and I'm sure they're doing it in San Francisco. But I think the money for that is coming out of like the emergency fund. I'm really not exactly sure where that's getting paid for, but that's what my guess is. And Louis, maybe you know more about that.
Yeah, I'm not sure. I'm looking at the number of messages we have backing up here, and I want to make sure that we try to get to as many as possible. There's a question here from, is there any landmark legal cases or technical assistance from the US DOJ to provide additional guidance for Title II entities responsible in emergency management? Yes, there are. And we have actually, this is a good opportunity for me to point out that if you go to adapresentations.org in our emergency section and go into the archive, you will see summaries of those cases in more than one webinar there, as well as, so you can actually hear summaries of those. There was also, the Pacific ADA Center has a paper that was written about the cases and a summary of all the cases involved in emergency management, and you can find them that were Title II cases, and you can find it at that link that's up on the screen, adapacific.org/emergency. Beth Captioner, I just want to let you know that somebody is saying, just wants to mention how great the captioner has been throughout this event. So I see. Okay, so there's a few. So there's a few people who have clarified the issue about slide 44 and 45. So can you go back to 44, Gabe? On slide 44, the technical assistance is repeated at 2 different percentages. I see, yeah. I see. You see that, Robin? That might have been a typo.
I think so.
Okay.
You mean technical assistance?
The 39% provide technical assistance and 24% provide technical assistance.
Technical assistances, they are acting as the consultant within, like, for OEM. So they're providing technical, which is, you know, an appropriate role. But who is responsible overall for ensuring that there is access with every aspect of emergency management? And a lot of them originally said yes, more than half. It's them.
Right. So for those of you who've been asking about the adapacific.org emergency link is the wrong one. It's the new one is in the actually looks like we didn't put that into the to the entire for the entire audience. Gabe, can you repost that to everyone? You sent it to the panelists. Okay, so another question. I guess I was asking more about the people who create the general model. If all EOCs, Emergency Operations Centers, use the same general framework, logistics, planning, operations, and finance or admin, that model came from somewhere. Can someone talk to that model creator to add in access and functional needs? Do you know about that?
That model came directly from the national framework from Department of Homeland Security. And it started right after 9/11 in the 2002 framework that was published. And so that's a very standard model. The problem that I have with the model is I don't really see the ADA coordinator in that model. That's a gap in the model. I think if that was in that model of leadership, and it should be, right? It's so important. It should be, then these problems would not be happening. So that maybe that will change. I mean, I'm hearing a lot of murmurs from the people I know in the field of emergency management, very high up, that is saying we need a major reboot of our entire emergency management system in the US. After COVID, we need a major revisit. And that will be definitely something that I would recommend up through the chain of the people who are really in charge. But it should be absolutely in there. But it really isn't. And every single OEM can kind of do, and they vary tremendously in their capabilities and their size and what their trainings are. So they vary, even though we have that framework, they're pretty much, you know, on their own in many ways.
The next question asks, where can ADA coordinators find funding for training projects, etc., for their jurisdiction?
That's a great question, Gabe. I hope you have the answer.
I'm going to say that there's not necessarily a location to find that, but I do think that in your jurisdiction or jurisdictions need to consider ahead of time as they set up a budget that is a consistent line item. That the ADA coordinator, I mean, it's of value, and I suppose the answer will sort of come from if you don't do it and a jurisdiction then ends up getting sued for it, it will end up being there through a settlement probably anyway. So it's probably best to argue to get that money set aside before anything happens.
I think, Louis, I think you're absolutely right, but I think I'm going to send you some links that I know of for foundation funding. And sometimes they are for things of that nature. It would probably just be, you know, funding, and those are usually typically small, under 100,000, but there may be some way to budget that to make it spread over a couple of years. So I'm going to send you those links, Louis, if you'll be kind enough to put them up at some place.
Okay, that sounds good. Gabe, it was the emergency preparedness website publications link. No, that you need to send it to everyone, not all panelists. Okay, next question. When today's webinar is made available to download next week, the chat text will also be made available, and you can copy and download all the links to the resources then. And thanks for raising that issue to us. We just wanted to make sure that a lot of you are concerned about the links. The links will be there, and you'll have it all. All the information will be available to you. Okay, we realize that many of you may still have questions for Robin or any or rest of us, and apologize if you didn't get a chance to ask your question. But again, I would encourage you to call your regional ADA center at 1-800-949-4232 to ask your questions, especially if they are specifically around the Americans with Disabilities Act. All right, you will receive an email with a link to an online session evaluation. Please complete that evaluation for today's program, as we really value your input and want to emphasize the importance of this work to our funder. We want to thank Robin today for sharing her time and knowledge with us. And a reminder to you all that the session is being recorded, and it will be available for viewing next week at adapresentations.org in the archive section of the emergency management area. On our next webinar on May 14th, we will be joined by the California Foundation for Independent Living Centers and another independent living center for a presentation on using the California Power Safety Power Outages for inclusive emergency planning. And we hope that you can join us. Watch your email 2 weeks ahead of time for the announcement of the opening of the registration for that webinar. So thank you for attending today's session. Thank you again, Robin.
Thank you all, and please stay safe.
All right, and have a good rest of your day, everyone. Bye-bye.
Bye.